Hello everyone, this is Marine Fatma, and today I will be presenting my focus group interview project. So my topic is exploring dietitian counseling strategies and the influence of social determinants of health on dietary adherence in older adults with type 2 diabetes. So first, I will be talking about the goals and purpose of the project. So this focus group interview allows the collection of diverse perspective from nutritionists and to get an in-depth discussion of strategies to support dietary adherence, specifically among the older population with type 2 diabetes. So the research question is, how do nutritionists discuss their strategies and address these challenges in promoting adherence? And then the goal is to identify barriers and effective counseling strategies. So the purpose is to understand real-world challenges and gather nutritionist perspectives on strategies to improve the dietary adherence. And my motivation to choose this studies to address gaps between dietary recommendations and patient adherence in practice. So social determinants of health assessment and importance. So the focus group finding indicates that nutritionists employ effective counseling strategies for older adults. However, the success of these interventions highly depend on the socioeconomic circumstances. So the interview highlights the two prominent key social determinants of health are the economic instability and transportation barriers. Also, the healthcare access is one of them. And findings highlight limited access to supportive resources. So there are resources available, but some of them are limited resources, or maybe patients are unaware of those resources. And it demonstrates how social determinants of health impact diabetes self-management. And the importance highlight how it addresses real-world nutrition challenges and provides insight for improving counseling strategies. Also, it helps bridge gaps between research and practice. So I have reached out to the same participant I have interviewed for my key informant, and all the three participants agreed on being a part of this focus group project, and two of the participants are outpatient dietitians, and one of them is the registered diet technician I've interviewed. The recruitment conducted through email, and I sent them the study details and consent information ahead of time, and interview date and time arranged based on the participants' availability. And all three of them selected Zoom as their preferred interview format. One of the challenges I have experience is that one of the dietitians have very limited availability, just like twice in a week. But due to the flexibility of other dietitians, I was able to accommodate all the participants. And then I sent them a follow-up email that include the informed consent form and Zoom link. And before the interview, I have taken their permission to record the interview and also ensure them that the details shared during the interview will be confidential. And after gathering all the data from the interview, I have used a grounded theory qualitative approach to examine how nutrition professionals support dietary adherence among older adults with type 2 diabetes. And then the analysis was guided by generalizing process allowing themes to emerge organically from the data rather than predetermined. And the interviews were transcribed using online transcription software and manual coding used to carefully review and interpret transcripts. And then the data was analyzed first with the open coding. Which result in a list of open codes and themes, such as limited income, high food cost, transportation barriers, and family influence. And in the Excel coding phase, related codes were organized into broader themes. For example, transportation issues and missed appointments were classified under access barriers, whereas limited income, food stamps, and high grocery costs were grouped under financial constraints. So these are the research modification and lesson learned. So I have revised the question for clarity and deeper discussion, and then additional follow-up questions were added based on participants' answers. And there was a great focus on financial, transportation, and family-related social determinants of health factors. There were new themes emerge, role of family and social support during the interview. And what I have learned from the interview is that clear wording improved participant understanding and open-ended questions encourage detailed responses. Also, the adaptability during the interviews strengthened qualitative data collection. So, okay, now we'll discuss the data analysis. From all the three participants, I have gathered the information. I then divided into like the open coding the first, and then the Excel coding, and then at the end with the selective coding. And then the themes were developed with the findings from both from all these open Excel and coding and then into broader categories. And these themes represent the central ideas that emerged after combining the experiences and perspective from all three nutritionists. The main prominent themes that were emerged is the financial barriers to healthy eating, and then access and transportation challenges, access to healthcare and transportation. The unexpected themes were, like I discussed, is the role of social and family support and monitoring and assessing dietary prevalence. So these are the social determinants of health and perceived barriers. The first one is the financial barriers. So like I talk about here, the first one is the prominent financial barrier to healthy eating. Now, this comes under the financial instability, social determinant of health, where the patient can't afford healthy foods and have to choose what fits the budget. And the other one is the access and transportation challenge, which related to the perceived barriers, how hard it is for patients to get to stores or appointments or reliable transportations. So key findings from the interview is that financial instability limit access to healthy foods and transportation barriers reduced access to healthcare and grocery stores. And then family and social support influence dietary behaviors, and structural barriers impact adherence more than motivation alone. So both of the motivation, the like self-management and the social barriers would play an important role. To see if the patient, if the dietary adherence is being promoted or not. So relevance to nutrition research highlights the real world challenges in diabetes management and emphasize the needs for individualized counseling and support. And it does show importance of improving resource and accessibility. Also, some other key finding is that the income, transportation, and healthcare access directly affect dietary adherence. I think we discussed that. And then health outcomes are influenced by both individual behaviors and environmental factors. And finding support need for system level intervention alongside nutrition and education. So both the parts that play an important role in promoting dietary adherence. And in terms of broader significance, it identifies gaps in resources and support services, highlights the need for food assistance and transportation support, and also contributes to future nutrition intervention research. Some of the implications are is that um, um, it is very important to provide individualized and culturally sensitive nutrition counseling, screen patients for financial transportation and healthcare access barriers, and strength collaboration among dietitians, social welfare workers, and healthcare providers. Also expand transportation and healthcare support services for specifically for older population, and support policies that improve the insurance coverage for nutrition related services. There are some recommendations that were discussed during the interviews to conduct large. I think it is important to conduct large studies with more diverse populations. I'm sorry, that wasn't discussed during the interview. That is something I've learned is that to conduct larger studies with more diverse populations and then include both patient and healthcare provider perspectives. This will help get a more detailed, in-depth understanding of of the counseling strategies or the challenges dietitians are facing to promote dietary adherence, and also explore community-based and system-level interventions, examine relationships between dietary adherence, protein security, and ANC outcomes, and again develop strategies to improve long-term dietary adherence among older adults with type 2 diabetes. Okay, guys, thank you so much for listening. And take care.